Did you know that 80 to 90% of all children have upper cervical dysfunction at birth, and that chiropractic adjustments can help a child's prefrontal cortex to process their environment and regulate their body's stress response? It is also known that children with ADHD and ADD and sensory processing disorder can improve under chiropractic care. In today's Special Needs and Disability show, we're going to be talking to Dr. Evan Pridmore about chiropractic care for neurodiverse children, and we'll touch on stress physiology, vagal tone, neurodevelopment. So don't go away. We will be right back with Dr. Evan Pridmore. If you have just joined us, you are watching Special Needs and Disabilities Live TV. I'm your host, Brigitte Limbanda from Cape Town in South Africa, and our live stream is made possible by StreamYard and BeLive Media. A special warm welcome to you, our audience. This is an audience-centric show, so do know that we are monitoring the comments. If you've got any questions for our special guest today, please do let us know in the comments. And if you've never watched a show before, we'd be happy to give you a shout out. In today's show, we're going to be talking to Dr. Evan Pridmore about chiropractic care for neurodiverse children. But first, I want to say a warm welcome to my friend and co-host, Mary Elizabeth Jackson. She is a special needs and disabilities advocate. She's also a ghostwriter and an award-winning author. Her latest book is called Cheers from Heaven with her co-author, Thornton Klein. And that book focuses on lessons we can learn from bullying, and it empowers families with the ability to grow from that experience. Mary's in Nashville in the USA, so wherever you are joining us from, because I'm in Cape Town, a huge, big, warm welcome. And with that, Mary, welcome to the show.
Hi, good morning. Thank you. And we are super excited to be here today and share Dr. Pridmore with our audience and just learn, because we always love learning, don't we? And we get to learn so much when we do these shows and then get to share it with other people. But I'm doing great. How are you doing?
I'm doing great, and I'm really also looking forward to our conversation today. And you know what? I've got nothing against doctors who are single or don't have children, but I think to me, it's very special that our guest today, Dr. Evan Pridmore, is not just a chiropractor who specializes in perinatal and pediatric care. He's also a husband and father of 4.
To be four. To be four, right? Yes.
So he knows firsthand the kind of challenges that families have to deal with. And I think that makes anyone a little bit more empathetic to the family dynamics and the needs of the family situation. And so he operates from the TruRoots Chiropractic in Mount Juliet, Tennessee in the United States. And focuses on improving the health of the nervous system through state-of-the-art instrumentation and diagnostics. So if you're watching the show and you've got a special needs child, or you know someone with a special needs child, and you'd like to know more, then you are in the right place to join us today. And so we're not going to waste any more time. Let's welcome Dr. Evan Pridmore to the show. Dr. Evan, welcome.
Thank you. I'm
Hi.
excited to be here.
Yeah, we're about 40 minutes from each other. So, yes. But I'm so glad you're here. And yeah, it really does give you a different perspective, doesn't it? Being a parent yourself and yeah, going through that, trying to help your wife through the birthing process and, getting to see what a woman goes through,
Mhm.
and the whole bonding and nurturing and it's wonderful. And, you guys, whenever we come into the office, your little one is usually there,
Yep.
right? Yeah,
Answering phones, putting fires out, starting
that's right. Well, she
fires.
waves at everybody, right? Blows kisses. So it's really precious. And it is like Brigitte said, I don't know, it kind of it gives you a different, um, it equips you differently than someone who is not. So.
For sure. We've had multiple birth experiences too, of going more the traditional route and then also home birthing. So we've kind of done it all. So from our experience, we're able to really feed into other people and be able to be a resource and answer questions to help guide them through that process as well.
Nice. Very nice.
So can we start off by, if you could explain to us, Dr. Evan, the difference between a general chiropractor and someone like you that specializes so that parents,
Sure.
understand what the difference may be?
Absolutely. Yeah. Going through chiropractic school, just like going through medical school or any other school, you get the general education of what you need to be able to serve. But then from there, you can take it into different avenues, whether it's sports medicine or personal injury or pediatric neurodevelopment and perinatal care. So there are different kinds of chiropractors for different specializations or different populations that they serve and care for. We care for everybody. We see, I think our oldest practice member now is like 94. But and really just wanting to stay healthy, not so much fixing problems. But where we really, our niche, where we really, where our heart is taking care of children, because healthy kids grow into healthy adults have healthy families. And if you really want to break this chronic degenerative disease cycle that we're continuing to see rise just in numbers across the world globally, whether it's depression or sensory processing disorders or cardiovascular disease or cancer, it's just a rise in sickness across the board. If we really want to break that trend, then we really need to start with our children and build them up so that way they can develop better practices. And then ultimately, that will trickle down to their children.
Yeah, absolutely. And that kind of goes across the board, even with teaching them even positive language and how to process their, not just how to take care of their bodies, but how to process what's happening in their bodies, how to process the emotions that they have so that they realize they have a choice in
For
this
sure.
world. They don't have to be depressed or they don't have to bully or be bullied. Suicide doesn't have to be like the only answer for a child for them to go. And I know that's an extreme, but we have seen a rise in that,
Especially in the
especially
last
in
2
this
years.
yeah, it's just off the charts. I know. So talk to us about what stress physiology is,
Sure.
and so that we can share that with other people, what that means exactly.
Absolutely. So stress, if you kind of understand, if you really understand base physiology, stress is really the precursor to chronic disease and breakdown. Or I should say the inability to adapt to your stressors. So all stress is, and all sensory input is coming in and being perceived by hypothalamus. Okay. Hypothalamus is grand central station. It's scanning and making sure that all the data coming in is safe. And if it's not safe, then it shifts the body towards more of a survival response, or what's called a fight or flight response. If the data coming in can be processed appropriately and we can mitigate that stress effectively, then the body can stay more focused in a state of repair and development, or what's called higher or parasympathetic tone. So we have rest and digest versus fight or flight. Okay, so and it's kind of a yin and yang to each other. They both happen at the same time, but there needs to be a balance to it, a dance, a harmony. So, and if we look at some more traditional or modern birthing practices, especially in the United States, statistics other places are a little bit better, like in the Nordic countries, but our birth outcomes are really, really poor in regards to maternal mortality rate, fetal mortality rate. So most of our common birthing experiences are, if you ask a woman about her birthing experience, It's almost never in the general sense like, oh, it was the most amazing, empowering experience I've ever had in my entire life. Like, it was amazing, it was beautiful, I felt so strong, right? That's never the language that you hear. Because most of what people perceive in birth is what they see on TV and like ER, and that's just that is a way to do birth. There are other ways to do birth too. And baby is imprinting and feeling and experiencing everything that you do from a physical, chemical, and emotional state. That imprinting and sensory process actually begins between 12 and 16 weeks of fetal development. So they can actually start to feel sensation and hear sound in that time of gestation. So what we are hearing and feeling and thinking and experiencing is directly correlative to what the baby's feeling and thinking and experiencing. So if in preconceptive time frame, if mom's been stuck in stress physiology, it's going to make it harder to conceive, but it's also going to make a poor environment for baby to grow in, because if all the perceptions of mom are stress physiology, then all the perceptions of that developing fetus is going to be stress physiology. And if we go through more of an allopathic birthing experience of induction, which is a synthetic hormone application, and then we numb them up so they're dissociated from their body and they can't feel that experience. Also, if cesarean versus vaginal is going to yield a very different outcome in regards to neurodevelopment and physiology from a microbiome development. The first bacterial exposure comes through mom in the vaginal canal, and we know that the microbiome is foundational for psychoneuroimmune modulation, regulating the immune system or developing the immune system, regulating and developing your mental health, and regulating and developing your central nervous system. So coming through the vaginal canal is where you're going to get that first bacterial exposure from mom. And if you don't get that bacterial exposure from mom and you get it from a hospital setting, typically the bacteria that really like to hang out and stay in hospitals aren't really the ones that you want as part of your physiology.
No.
And so we're born into, a stressful, alarmed state, and then we're taken from mom typically, and then poked and prodded a little bit, and then we're given back to mom eventually, if everything goes well. And the inverse of that, like what's done more in midwifery groups, as well as more like a natural birthing process. And I know specifically in the Nordic countries, which 98% of their births are attended by midwives and doulas versus obstetricians. And they have way better birthing outcomes because it's a lot more honoring to physiology and baby needing mom and mom's body temperature and the smells and the sights and the sounds in order to help them regulate and adapt to their new environment. So it's just a different experience, right? And so if we look at the allopathic experience, stress physiology from day one, like boom, like you come out of the gate and you're stressed because you're trying to survive, versus a more gentle welcoming into the world where you're feel a little bit more comforted and bonded because you have a lot of that skin to skin contact, that golden hour with mom where you're allowed to breastfeed and latch. And it's just and I've done both. So I have felt and experienced both of those experiences. My wife and I talk about that, and it's vastly different, the bonding experience you get to have. So, baby comes out, and if it's cesarean, you're going to have higher rates of dysfunction in childhood and adult disease processes. But come out, you're stressed, and then, if you guys have kids, they're little trauma monsters, and they just beat the heck out of each other, and they incur a lot of stress and wear and tear and damage. And then when we get into our 20s, 30s, 40s, 50s, it's like, man, what happened? I just picked up a piece of paper and something blew out. It's like, well, it wasn't the paper's fault. It was the 30 years of wear and tear and damage done prior to that led to that point in time. So if your stressors are allowed to supersede your body's adaptation or your ability to process that stress, you're just going to see a system fail faster. And unfortunately, that is what we're seeing in our pediatric population. Between birthing outcomes and agricultural practices, and nutritional practices, and lack of movement, which kids move 33% less than they did 5 years ago even. So there's just a lot of cumulative stress adding up in a much shorter time frame from an environmental standpoint than we've had to deal with previously in previous generations, which is why we're seeing systems fail faster. And if we're not supporting their physiology and helping them to adapt to their stressors and giving them good metabolic practices and nutritional practices, then that system will fail fast.
Wow, that was quite a lot. I mean, there was a lot of information that you sort of downloaded there, but something that piqued my interest is, the importance of children needing to move and moving less. And I know that some special needs children have a need to move a lot more than children who are not in special needs. And I was just wondering, you look at the way the traditional schools have gone, and I think the Montessori's got different approaches, and so they're
Mhm.
more kinder to young minds developing and
Yeah.
touching, feeling, and their way through the education. Whereas in the regular environment, children are deemed naughty if they move too much. It's like
Yeah.
to the naughty corner with you. You're not sitting still long enough. Are we
Mhm.
damaging our kids by restricting them from moving around if that's what they require?
Yep. Basic primitive input to the nervous system is based upon joint position and movement, or what's called mechano and proprioception. It's the most amount of data the brain receives, and it starts from day one, and it doesn't shut off when you're sleeping either. And so the quality of that data getting to the brain, or what's called afferent signals, input to the nervous system, the quality of that input to the nervous system is what the brain relies upon to organize itself, create efficient neuroplastic changes, or start to develop synapses and get to higher states of cortical function. And then if we get good quality input, we're going to get better quality output. Okay, so that's and if we get crappy input and then you get crappy output, it's called a negative feedback cycle. So we need to give the brain the basic and primitive data it needs to organize itself so we can get higher states of development, which is why the chiropractic adjustment is so profoundly beneficial, because we know without a shadow of a doubt that an adjustment specifically to the upper neck or to the pelvis specifically, restoring mechanics and structure, is going to drive better information to the brain, better quality data, that basic mechano and proprioceptive input, which is why in our office, when we see heavy sensory processing cases, or children or even adults with Down syndrome, outside of aches and pains improving and their inflammatory response improving because their body's down regulating stress, so therefore it can regulate inflammation more efficiently. We see improvements in all variations of autonomic function, whether that's digestive health or processing or communication or regulation of emotions and behavior, because again, the adjustment helps give the brain the most basic input that it needs. And what's really cool, some research coming out of New Zealand by Dr. Heidi Havoc, PhD, just pumping out a ton of research, is she's starting to show how that kind of care activates and stimulates different parts of the brain. So specifically, one adjustment activates or stimulates the prefrontal cortex up to 20% increase, which is where you need to be for processing of emotions and behavior and fine motor skills and critical thinking and agreement and just like all higher cortical states of function. So if you want your brain to process more efficiently, then you need to give it the right data and the right input. And so that's what we accomplish with the chiropractic adjustment.
And the right food, correct?
Yeah, absolutely, because the gut is your second brain. What's going on in the gut and the little bacteria in there are communicating via the vagus nerve. It's a cranial nerve. It's a nerve that comes directly from your brain. Goes from a little hole in the bottom of the skull and then in front of your C1, C2 here, which is why an adjustment to the upper neck stimulates vagal tone. And then that goes over your heart, stomach, all the way down your reproductive organs. Vagus in Latin means wander or traveler, so it kind of goes everywhere. It's a super cool nerve, but its job is to maintain homeostasis, keep everything in harmony and balance. But it's one of its primary functions is to communicate via what's called the gut-brain axis. It helps your brain and your stomach talk back and forth to each other. And the bacterial populations and what's going on in your stomach, again, is going to greatly influence your immune system, your mental health, and the development of the brain.
Are there any ways that parents can tell if their child needs an adjustment?
Really good question. I could give you a very specific answer, but I'll keep it more general for this one. If you have a spine and a nervous system and you're experiencing some variation of physical, chemical, and emotional stress, you should probably
need adjustment. Yeah,
basically.
that would help, right?
Yeah,
Okay.
just based on sheer statistics, 80 to 90% of all newborns, as soon as they come out, just due to the birthing process, have upper cervical dysfunction. We've been talking about it for 100-something years now. Dr. Biederman, who's a German physiologist, a few years back, coined it KISS syndrome. But basically, any distortion to the upper cervical spine here is going to impact blood flow to the brain, venous return, cerebrospinal fluid circulation, and the exchange of information through that central nervous system. And then your infant really relies upon movement-based data in order to get, again, to higher states of development, which is why they move before they talk. And the majority of that input, 30 to 40% of all mechano and proprioception, comes from right here. So if this area is distorted, you are distorting neurodevelopment. You're creating inefficient neuroplastic pathways.
Okay, that's really, you just touched on something right there. I know we could talk for hours with you, but because there's so much information, isn't there? But I didn't realize the proprioception area was back here, but it makes sense because, and it was so funny, the first time I ever said that word to my husband, he goes, "That's not a real word." And I said, "Yes, it is." So because Carson has had a lot of sensory issues with his proprioception, so it's been a lot of his OT over the years. And what proprioception means is where you are in adjacent or, accompaniment of your space. I'm here, the table's here, my chair is here, my feet are on the floor. So because it's a spatial thing, that makes a lot of sense that it's back in here, because that's your ears and your sense of balance.
And your cerebellum, right? So the majority is here. It's really everywhere. It's in any joint that moves. It gives you proprioceptive input. That's why when I close my eyes and I wiggle this finger, I know it is right here. Right.
Okay.
So without visual input, that's how the brain's getting the most amount of data.
Fascinating. Can you touch on the vagal tone? And
sure. Yeah. The vagus nerve, super, super cool.
It's a big one.
It's so important. But stimulating the vagus nerve or having appropriate vagal tone is going to allow you to engage in more positive social relationships. Remember, we talked about that sympathetic side of things, that stress physiology. So sympathetic, if we're in a sympathetic dominant state, we're not going to be prioritizing social cues, social development, and regulation of behavior and emotions. We're going to be prioritizing survival. So if there was a tiger in the room trying to eat somebody, it wouldn't be very efficient for your brain to focus on digesting food, reproducing, regulating the immune system, or any sort of positive social relationship. So stress physiology is going to mess with your behavior, but also those other processes we talked about. So in this population, usually in the sensory processing community, it's not just autism or it's not just ADD, ADHD. There are multiple compounding factors of digestive dysregulation and chronic immune issues and other aspects going on. So from sympathetic, you get to parasympathetic, which is your resting, digesting, which is where the body can really focus internal on development. But you can't actually engage your vagus nerve effectively. You can't get to states of social cues and social development if you're at least not in a state of rest. So it's kind of sympathetic, parasympathetic, and then social vagus or vagal tone. And this is from work from the book, The Polyvagal Theory. And I always say his name wrong, but Dr. Pogues, Pogues, amazing, amazing book, really wonderful work. But stimulating the vagus nerve is really going to help people regulate things like anxiety, mental health issues, again, their immune system and the development of their nervous system. So very positive things that you can do on your own time to help stimulate the vagus nerve: cold immersion therapy and breathing exercises. So if anybody's familiar with the work of Wim Hof, the Wim Hof breathing method, the Iceman, that guy, yeah, super cool. Climbed Everest in like shorts and sandals. He's amazing. He can regulate his own body temperature somehow. Again, his stuff is baffling to think about. But breathing, stimulating the diaphragm, so big, big, big diaphragmatic belly breaths like you would do as an opera singer, will help regulate the vagus nerve. Cold immersion therapy or taking a cold shower or cold bath or splashing cold water in your face or going to do some snow angels will help you regulate your vagus nerve. Singing, humming, oming, chanting, laughing, anything that's going to stimulate the vibratory effect of the throat is going to stimulate the vagus nerve as well in a very positive way. So again, social recognition, communication, laughing, singing, anything that's involving the throat is going to be really good for vagal tone. Shameless plug, the chiropractic adjustment is very powerful in influencing the vagus nerve as well. And then exercise. And the two most well-researched forms of exercise that show improvements in neurology, but also stimulating the vagus nerve, are yoga and Tai Chi. Tai Chi is a little superior or better than yoga from my understanding of the published studies in the field of exercise physiology.
So what is it about Tai Chi and yoga specifically that makes it an excellent form of activating your vagal tone or improving it?
Good question. It's movement, body consciousness, and then also facilitating a lot of extensor tone, driving information through the extensor surfaces of the body, drives input again to the frontal and prefrontal cortex. So the fact that we're seated in a flexed position in school for, or in work for 8-9 hours a day, when in nature, in your Paleolithic ancestry, when would you ever assume like a hyper flexed state? Most of the time when you're in a stressed state, right?
Mm-hmm.
Like when you're hunting or gathering or attacking or hiding, right? So postural tone, flexor tone or extensor tone is actually going to help you manage and manipulate your own stress physiology. So being in a flexed state, activating elbow flexion and shoulder flexion and hip flexion for 8 to 9 hours a day is actually driving postural information to the brain saying, hey, you need to be alert and stressed and on edge to make sure you can survive. Engaging a lot of erector tone, extensor tone, and upright posture and physiology, which is why movement is so important, is going to help activate the cortical centers of your brain that you need to regulate your emotions and your behavior and your cognition.
Wow. And Tai Chi is also very important because a lot of the movement, I know there's one that my son is starting to focus on, and it is a primitive reflex, but it's the whole crossing over of the right to the left.
Going across the midline of the body.
Yeah. So he's focusing on drawing like an 8 over and over again, and he has to watch it.
Nice.
So that what it does is engage both sides of the brain and the body.
And then also if you have like a retained Moro reflex, a startle reflex, if you're an individual that like somebody is 20 feet away from you, they're like, hey buddy, and you go, like that's, you have a retained startle response, a Moro reflex. That's an infantile reflex that's vitally important in the first 1 to 3 months of development, as it helps really downregulate the SIDS, sudden inflammatory distress syndrome, because that's how the brain alerts itself and then re-engages cardiovascular and respiratory centers. But it needs to go away at specific, and actually swaddling is making this problem worse. So swaddling children and keeping their arms hugged next to each other, it will help them to get to a rested state faster. However, we actually need that reflex in the first 1 to 3 months, and we want it to go away within like a 3-month time frame-ish. So if it persists past that, then that's what's called a retained primitive reflex. And that means they're stuck in a state of delayed neurodevelopment because of some of the parenting practices we have. Now, as a parent, it's great because you're like, oh, the baby's sleeping through the night. I'm sleeping through the night. We're doing so great in the first 1 to 3 months, but is going to have, unfortunately, neuro complications in the future that were unintended. It was done from a very loving place of wanting your baby to sleep more, but it's actually going to complicate their neurodevelopment going forward. And then if you have that startle reflex as an adult, there's parts of your brain and your physiology that are so stressed and regressed that it's back at a 3-month state of development. So a really great activity to change that is
Thank you. I was going to ask.
Yeah, is primitive reflex integration. Now there are a ridiculous amount of primitive reflexes that help your baby to adapt to the world. And that's what we're trained in as pediatric neurodevelopmental chiropractors, of assessing these things and making sure that they're on track for appropriate neurodevelopment. We're not looking at, vitals and sickness and those kinds of things. That's what your medical doctors and your pediatricians do. We're looking for, and that's like sickness to baseline physiology. What we're looking for is baseline physiology to optimal performance and development. And that's kind of the lens with which we look at the body. But anyways, there's so many reflexes, but the one specifically for the Moro or startle reflex are what's called starfishes. So take your arms and your legs, open them up as wide as you can, and then slowly bring your limbs across midline. So left over right, and then right over left, arms and legs multiple times a day. And then that'll dampen your Moro or startle reflex, and that'll help your brain integrate that sensory input. And then you'll advance past that. So that actually be really good for people that have a lot of trauma or history of trauma. Mm-hmm. So we do work with trafficked women as well. And Dr. Jay Holder, who developed the technique that we utilize in our practice called torque release technique, is shown to change the reward cascade pathway of the brain, and also helps elicit changes on EEG. So for people with like seizures and epilepsy.
Wow. I mean,
that's very interesting.
Yes. Yeah. For Brigetti and I both were like, okay, so there needs to be the new books written. And so everyone study them because, we're getting so much information here. And I hope that everyone watching this now or on the replay really is hearing all that you're saying, because we definitely need to be parenting differently. I mean, you're saying things that Brigetti and I both are like, wow, we wish we had known that with our babies. But yes, what were we doing? We were doing what we were taught to do. We were doing what we thought was the right thing to do. And like you said, in love, and in the form of love, a lot of times, not realizing and I'm thinking about my 18-year-old, and her startle reflexes are awful. So I'm going to be having her do the starfish.
Starfishes. Yeah.
Yes.
Very good.
Oh my goodness, that is very, very, very interesting, and if you find that your reflexes are not working the way they should be as an adult, can you still reverse it with chiropractic care?
Absolutely. The brain is so plastic. It's changing literally every second of every day. Again, the brain relies upon its environment and the information it's receiving to organize itself. So if you change the quality of the data and you change the environment, basically if you change stress or how the brain is perceiving stress, then you'll see improvements in your states of neurodevelopment or neurologic health. One of the most common things I hear from people that don't have any sort of sensory processing issues, when they start care, is they're like, hey, like I'm sleeping way better. Is it possible for like my memory and recall and like cognition to improve? I'm like, well, yeah, and here's why. And here's what the research says. And, so yeah, absolutely. The brain is constantly changing, and which is actually a really hopeful thing, because that way, whenever we get a diagnosis or something that's like, hey, this is what you got and this is what you have to live with, it doesn't really have to be that way. And actually, genes can activate and change their expression of themselves based upon the environment and what's going on in your body and what's going on in the world and how your brain's perceiving things. So if we can give the brain better input, we can actually get a better expression of our genome. So let's say mom and dad, gave you a gene that codes you for potential breast cancer. Like Angelina Jolie did this a while back, where she realized she had the BRCA gene, so she had a radical double mastectomy and to prevent the potential for breast cancer. But that gene could potentially never activate or turn on if she makes X, Y, and Z lifestyle choices.
Right.
So your genes, we used to think that our genetic code is just the way it is, and this is what I have to deal with. Not the case, especially if you focus on the health and development of your brain and the health and function of your gut. If you knock out those two, if you can get your neurologic health and your metabolic health in order, man, sky's the limit. It's pretty awesome. And then you're going to see even greater advancement and improvement from all the wonderful therapeutic applications that are offered out there from like a PT and OT standpoint. I just look at it from a different lens. Like if the brain's not getting the right input and the body's in a state of chronic inflammation and stress, then are those therapies of benefit? Absolutely. But could you maximize the benefit of those therapies if you had a healthier system to integrate that information that you're trying to give it?
Yeah.
Wow, that's amazing. So I was just thinking, say for example, parents now who's adopted children and they came from a really, really bad situation where the mother or father were drug addicts, for example. Can you change the outcome based on what I'm hearing you saying now, with the input that child receives from the parents who are more stable and with the correct treatment?
Yeah, there are limits to physiology. There are limits to matter, unfortunately. If for example, if the baby was damaged in such a way that one of their kidneys is gone, I can't magically bring that back, but we can still improve upon what their potential is. And I don't know what your potential is. Nobody does, right? That's why every time we host the Olympics, there's new world records. Nobody knows what the potential of the human body is. So rather than focusing on what's not there or what happened in the past, yeah, it's important to understand that, but really we're going to focus on, okay, where are you at now and what can we improve upon? So in short, to answer your question, yes, it is possible to improve their expression of their health. Will that ever be normal physiology? Don't know.
But at least it's better than nothing. It can
That's
help.
exactly right. Yep.
Yeah.
Yep.
So going across the bottom of the screen is the website where people can find a practitioner like you, no matter where they are in the world, right?
Correct. Yep.
Well,
International Chiropractic Pediatric Association. So the website would be the ICPA 4, the number 4 kids. and there's a parent portal on there. There's a ton of published research in there, as well as a directory where you can find other providers like me.
That's awesome. Can we touch just a little bit on the role that gut plays in the function of your neuroimmune modulation?
Sure. Super, super important. And we're all starting to, I think we can all agree, we're starting to hear more and more about this in the last like 3 to 5 years, yes. Right? So the way medicine or health works is, we have a topic that's heavily researched for, 15, 20-year period of time, goes into animal studies and then human trials, and then eventually makes its way into clinical application. And then after clinical application, we have a bunch of review analysis of like, okay, what actually happened over the last 15 to 20 years, and was it what we anticipated that was going to happen? So where we're at in the timeline of this is the majority of this research has been in the last 15 to 20 years. So this information is really starting to get disseminated to the public, which is super exciting because it can have profound implications on how well your system and how well your child's system is going to advance past the current state of where it is. Your gut bacteria, your microbiome, we talked about a little bit earlier, comes from mom. We're 1/10 human and about 9/10 bacterial strains. So we're outnumbered in our own body 10 to 1 from bacteria to human cells. So if you don't think that this is important and it doesn't drive your physiology, it does. So those bacterial strains, there's hundreds of thousands of different ones, but we want to make sure that we have the appropriate ones in the right populations. And your 70 to 90% of the serotonin, which is your happy neurotransmitter, so if you really want to affect anxiety and depression, comes from the stomach and the small intestines, and then is communicated or stimulates the brain in a very positive way via the vagus nerve. So if you want to change mental health issues, you have to focus on your gut. You have to focus on your metabolic practices. Somebody can come in and get adjusted every day, but if they're crushing McDonald's 5 meals a day, 7 days a week, 365 days a year, you're taking 1 step in the right direction and 3 back, right? So it's more of a whole lifestyle kind of thing of, you got to get your nervous system communicating, but you got to quit poisoning your body and producing a hyperinflammatory state. Now, if that microbiome breaks down, then the gut lining is going to break down. If the gut lining breaks down, then you're going to start to get half-digested food particles and pathogens and junk integrating into your bloodstream that you don't want. And then your very intelligent body is going to start to try and regulate itself aggressively via the immune system. And that's what we know as autoimmune type disorders. So if we break down the microbiome, we break down the gut lining. If we break down the gut lining, the intelligent body has to start regulating itself, which means our body's going to start to attack itself, producing a hyperinflammatory state, ultimately pushing the body towards more of stress physiology. So stress can be coming in from a chemical, physical, or emotional standpoint. But got to take care of the health of the gut, got to rebuild the gut lining, have to help the bacterial populations in your system by putting less chemical irritants into the system, and then you'll see advancement and change.
That is amazing.
Wow.
Thank you so much for your time.
You're
much
welcome.
appreciated. And
I have more questions, but I know you have to go.
Yeah, we got to start caring for people and serving those.
I know you do. We have to have you back on, okay?
Yep. Well, thank you for your time today, ladies. It was a blessing to be here. I really appreciate you guys. Hopefully, I get very passionate, so hopefully I didn't over speak or say too many things that are like, I have no idea what this guy's talking about.
No, it was extremely educational, I think,
Cool.
Brigetti, don't you? Yeah, absolutely. So we are so appreciative of your time, and we know you have to go to work, and we will definitely have to have you back on. But thank you so much for joining us today and sharing all of this knowledge. And and we will share, and then you can share this broadcast too. You can,
okay, great.
Play it at the office, right?
All right. Well, cool. And we'll have to put some Christmas music over top of it. But...
yeah, Christmas music over top. There you go.
Thanks very much, everyone. Thanks to our live audience, and also thanks to our replay audience. Dr. Evan, thank you so much for your time. Take care until next time.